If someone runs into traffic tonight during the rush hour because they have a mental health problem, would they be able to get emergency mental health treatment? Let's assume that they're not hurt. I bring that up because it actually happened about 15 minutes ago. I heard it on the police scanner in the newsroom. And I bring it up because you've talked to us a lot last week about a variety of mental health issues. And it's clearly something that concerns many of you. And some of you have shared the tragic circumstances that you are personally enduring every day. Others are trying to help loved ones who struggle with mental health. This is not a classic news story. Nothing's on fire. We don't have great visuals with this, but it's important in all of our lives. So we are going to keep talking about mental health. Now, getting back to that person in traffic, last week we learned if they could convince police when they show up that they're okay, it's possible that nothing happens. If police saw them do it or showed up and it was obvious that they're a danger to themselves or others, which is what happened tonight, then police can, or the medical folks can put a police or medical hold on that person and then force them to go to a hospital emergency room for evaluation. But then what happens? And what if it's just a family member concerned that someone's in crisis? Odds are someone will eventually ask about taking them to Unity. It's one of the main inpatient mental health hospitals in the Portland area. David sent us an email asking about it recently. Unity Center for Behavioral Health is a collaborative effort from several local healthcare systems, he writes, which is supposed to be addressing a lot of these issues. Your reporting has not mentioned Unity so far. How is it doing for the patients treated there? How is their aftercare related to patients treated in less systemic locations? Is it just a question of capacity versus need? Thanks for all those questions, David. I can't answer them all, but I do have some information. Today I was able to interview the president of Unity. Unity is located on Portland's east side, and it's a collaboration between 4 healthcare systems: Adventist, Legacy, Kaiser, and Oregon Health and Sciences University. The hospital opened back in 2017. It's cared for 22,000 people since then. It has room for 85 adults and 22 adolescents. But here's one of the challenges. While Unity has an emergency room that anyone in mental health crisis can go to, it actually has few openings for its secure inpatient treatment on a daily basis. That's according to the president, Melissa Eckstein. It seems like Unity is almost always full. Is that right?
One of the things about Unity is that, we have the only adult psychiatric emergency service, and that's available 24/7, and we are available for walk-ins. Our inpatient service is full every day, and as soon as we discharge a patient, we have somebody that's waiting to be admitted to that bed. Our ability to serve more patients on our inpatient units has been really deeply impacted by the lack of available step-down and community resources where we would normally discharge our patients to.
And can you explain what step-down is? I'll bet most people don't know what you're talking about on that.
Yeah, step down is what's available for an individual. Unity has one of the most restrictive levels of care that's available in our behavioral health continuum. It's a locked inpatient facility, and part of our obligation to the individuals that we take care of and that we serve is to be able, the moment that we think that they don't need that restrictive environment, is to move them to the least restrictive environment. So step down can range anywhere from just a walk-in outpatient appointment to a secured residential, to a group home setting, or possibly for individuals that have substance use disorder, to a treatment facility. So step down means a whole lot of things.
And you're saying, though, that statewide there's not enough of all of those programs?
We have definitely seen a reduction in what's available to us over the last 2.5 years with the pandemic.
Unity reported that people who are there voluntarily stay on average about 2 weeks. Those committed involuntarily, so against their will, typically stay more than 60 days. She was not able to quantify how many fewer places there are for her patients to go, but it's probably a more complicated question than it seems. The bottom line, though, it's hard to get an inpatient room at Unity, which the most seriously troubled folks need, because it's hard to find places for people to go once they're a bit better and no longer need that high level of care. As the system gets backed up, it affects a lot of people. Well, it's obviously a needed service. I wonder, do we need 2 or 3 more Unities in the greater Portland area?
I think that what would be most beneficial to our community is making sure that we don't have any stuck places in the continuum of care. And I think it's very easy to focus on the most restrictive level of care, which is inpatient, without understanding where those stuck points are and why it may be that people can't access inpatient treatment. I think that we have a lot of stuck points right now. I think that we don't have enough housing to move people into. And when I say housing, supportive housing for people that, putting them in a housing option, but not having follow-up care or a case manager that follows them, that helps them ensure that they're going to take their medication or follow up with their aftercare appointments. There's a lot of pieces that our community needs beyond just being in a hospital. And I think it's important that we focus on those pieces as well, and making sure that we have the right funding and the right workforce attached to the whole continuum, and not just our inpatient level of care.
Besides Unity, 3 other hospitals, Providence, Tuolumne, and Cedar Hills, care for the highest need psychiatric patients with that inpatient service. So instead of more hospitals like Unity, Melissa Eckstein thinks there is a greater need for more places where people can go as they begin to get better, but are not yet well enough to be out on their own. There is one other issue here, the nursing shortage. I found today that Unity has job postings for at least 6 psychiatric nurses, and they're offering a $10,000 signing bonus and help with moving. Eckstein said there has been some inpatient beds that could not be used there because there was no nurse to care for that person, although she was not able to share specific numbers. So the need is high, and there's a backup. We'll stay on this, and we also want your feedback as well. Are there specific areas of mental health in the system that you want us to explore? Are you dealing with this now and willing to share a bit of your story? You might help us all better understand this huge topic. Send me an email. The address is thestory@kgw.com, or call our phone number. It's 503-226-5090.